Hello, everyone, and welcome to today's event titled Prevention Perspectives, Substance Misuse and Overdose Among Urban Native Populations. I'm Sophie Chishty, and I'm a research associate with the National Council of Urban Indian Health, also known as NCUIH. Thank you all for joining us. You can go to the next slide. Today's event will be recorded for educational and quality improvement purposes. Please feel free to turn on your video to help us engage with you, and please mute your microphone when you are not speaking. You can also use the Zoom chat at any time to share any questions or thoughts. Next slide. So we welcome you to share your name, organization, and any tribal affiliations in the chat to help us connect with you. Our agenda for today's presentation will include this overview of the event, some background on substance misuse and overdoses, a summary of NCUIH's needs assessment, an open discussion, an open floor where you can ask any final questions, and a closing where we will share additional resources and closing thoughts. Our objectives for today's event are to increase awareness of resources and services related to substance misuse and overdose prevention, enhance understanding of successes, challenges, and needs of UIOs providing services related to substance misuse and overdose prevention, and foster connections between UIOs and facilitate conversations on insights and best practices. In addition to myself, you'll also be hearing from my colleagues Deidre and Nahla during today's presentation. Deidre is the Research and Data Manager at NCUIH, and Nahla is another Research Associate at NCUIH. The National Council of Urban Indian Health, also known as NCUIH, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is a national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service in the Indian Healthcare Improvement Act. NCUIH strives to improve the health of the over 70% of the AIAN population that lives in urban areas, supported by quality healthcare centers. We also have a brief form where you can share feedback on today's event, as well as share further insights into your experiences with substance misuse and overdose prevention. You can scan the QR code seen here or use the link in the chat in order to complete this anonymous form. This will also be shared with all of you following today's presentation. We appreciate your feedback and any additional insights you would like to share. So to begin today's presentation, we would like to first provide some brief background on substance misuse and overdoses. So first, we'd like to go over some of the key terms that you may hear in today's presentation. I'm not going to read every definition on this list, but I want to highlight a few that are the most relevant. So opioids refer to a classification of drugs that are used to reduce pain. Opioid drugs are made from chemicals which interact with the opioid receptors on nerve cells in the body and brain to reduce the intensity of pain signals and the feelings of pain. Opioid drugs can include illegal drugs like heroin and fentanyl, and legal prescription pain medications like oxycodone or hydrocodone. An overdose is an injury to the body in the form of poisoning, which happens when a drug is taken in excessive amounts. Overdoses can be fatal or non-fatal. Substance misuse is an umbrella term referring to the inappropriate use of substances such as drugs, alcohol, and tobacco. And this is a term you'll hear throughout today's presentation, as opioids are not the only substance that we will focus on. Next slide, please. So opioid overdoses have been increasing in recent decades for all racial and ethnic groups in the United States, but particularly for the American Indian and Alaska Native, or AIAN, population. Specifically, between 2019 to 2021, fatal opioid overdoses nearly doubled among the AIAN population. In 2021, this population also had the highest rate of fatal opioid overdoses compared to all racial or ethnic groups. Next slide. There are also disparities in fatal overdoses between rural and urban populations in the United States. The AIAN urban fatal overdose rate was higher than that of both the rural AIAN population and all non-Hispanic white populations in 2017, at a rate of 22.1 per 100,000 people. Next slide. So now we will move into our presentation of our findings from our needs assessment. So I'll now hand the floor over to Deidre.
Hi, I want to welcome everybody to coming and joining us today. My name is Deidre Greyeyes. I am the Research and Data Manager here at NCUIH. I've been here for almost 2 years. I am Navajo or Dene, and I am based out of Winter Rock, Arizona. I have at least 15 years of epidemiology or data analysis experience, and I'm really happy to present this project with Sophie and Nahla today. Next slide. So just a little bit of an overview. Our needs assessment project was funded by the CDC. It's a cooperative agreement number 0218802182. Our presentation today does not reflect the policy or positions of the CDC or any other partner who has assisted NCUIH in this. The key components of this project include attendance at the National Tribal Opioid Summit last fall, a review of opioid literature and policies, an environmental scan of UIO services, and drug overdose mortalities, key informant interviews with staff from UIOs, and today's event. In today's presentation, we will just be focusing on summarizing the environmental scan and our key informant interviews. May I have the next slide, please? Thank you. For our key informant interviews, we recruited 5 UIOs who each sent 2 to 3 staff members involved in their behavioral health services or departments to speak with our team. These UIOs represented all 4 major program types of UIOs and 5 out of 8 NCUIH regions. Topics explored those related to naloxone, group services, services related to drug or syringe disposal, forensic drug test strips, and pharmacy services. All of these services were mentioned by at least 3 out of 5 interviewed UIOs. When asked about their behavioral health services, the most common traditional healing services mentioned by interviewed UIOs included drumming or drum making, talking circles or healing circles, plant medicine, medicine bundles, and herbal pharmacies, as well as programming using the Red Road to Well Variety curriculum. All of these traditional healing services were also mentioned by at least 3 out of 5 interviewed UIOs. May I have the next slide, please? Thank you. So our key informant interviews obviously had some barriers and challenges. 3 levels of barriers and challenges related to substance misuse were identified from analysis of these key informant interviews. The most common barriers or challenges at the level of government agencies or policies and institutions included those related to data access and availability, safe drug syringe use or disposal, and the overall burden of keeping up with continuously changing and confusing legislations. These barriers were mentioned by at least 3 out of 5 interviewed UIOs. At the level of communities and their norms, all 5 interviewed UIOs reported barriers and challenges surrounding issues such as lack of knowledge, stigmatization, misconceptions, and transparent patient populations. At the level of healthcare organization and providers, at least 4 out of 5 interviewed UIOs described barriers or challenges related to issues such as capacities for key services like sober living or medical detox. So these key informant interviews, our team also asked UIO staff about their measures of successes they've experienced from beneficial policy changes and protective factors that are helping to uniquely support the populations they serve. Measures of success used by interviewed UIOs include evaluation, reporting, quality improvement, and tracking of patient outcomes. 3 key area policy changes which interviewed UIOs described as beneficial included those policies expanding the provision of medication-assisted treatment, increasing access to harm reduction services, and increasing funding overall for youth services. And In addition to that, key protective factors mentioned were connection to culture, diverse local community of Native organization and groups. Thank you. Can you go to the next slide, please? And presenting this section is my associate, Nahla.
Thank you. Hello, everyone. I'm Nahla Holland. I'm a research associate here at NCUIH, and I'm an enrolled member of the Eastern Pequot Tribal Nation here in Connecticut, which is where I'm located. Another component of NCUIH's needs assessment and the environmental scan was to estimate what proportions of UIOs offer key services related to substance misuse and overdose prevention. This data on the slide was pulled from NCUIH's UIO program profiles and from searching UIO media, such as their websites. NCUIH's UIO program profiles are an internal NCUIH document where we collect UIO services and programs for our reference. So please note that this data is by NCUIH's own estimates and does not necessarily reflect all current services at UIOs. This information was updated in 2023. The most common on-site behavioral health service offered at UIOs was counseling services related to substance misuse. But we also have other programs such as programs to educate the community, and coordination between primary care providers and behavioral health providers were also very common. And if you look on the slide, you can see other programs that were offered by UIOs related to substance misuse care and prevention. Next slide, please. Thank you. So an additional component of NCUIH's environmental scan was to map UIO geography and overdose deaths. So overdose mortality data that you see on this map was pulled from the CDC National Vital Statistics System, and it is the provisional county level drug overdose death counts data set. So this overdose data represents any form of fatal overdose among all racial and ethnic groups in the United States in the first half of 2023, so January through June of 2023. So even though this represents all forms of fatal overdose, not specific to opioids, the CDC does note that the majority of fatal overdoses in recent years, specifically in 2021, were opioid related. This data and data set is all publicly available on the CDC National Vital Statistics System website as well. So a few notes on the data included in this map is the data used for the analysis had a number of months where counties had data that was suppressed for data privacy concerns. So if in any month an individual county reported between 1 to 10 mortalities, that number would not be reported and was marked as suppressed in the data table. The data source would also report if a specific county had 0 mortalities in a given month. So there's a clear distinction between data that was 0 and data that was suppressed. So for the map you see on the screen right now, NCUIH adjusted the data so that for counties that did have mortalities in a given month, but could not be explicitly shared, we used the average value between 1 and 10, so 4.5 for that suppressed month. So this was done to ensure that the month was not mistaken in the visual map as having 0 mortalities in that month or in that time frame. And this process is called average value imputation, and it's a common practice we do when working with suppressed data sometimes. Additionally, this data is not a ratio based on population size. As we dive deeper into this map, please note that the numbers I'm going to show you are based on a total number of overdose mortalities, and it's that raw number. Lastly, data on the UIO service areas was pulled from NCUIH's program profiles from 2022 and may not reflect all current UIO locations and service areas. So you can't really see it on this map, but we do have UIO service areas outlined in green, but due to this map being so zoomed out, you can't really see it. But I'm going to share my screen in a second to show that. One more thing, though, is that throughout this process and working with this data set, the analysis highlighted for us the lack of available local data on overdoses, particularly for understanding the types of drugs involved in fatal overdoses and specific demographics affected, like different racial ethnic groups. Now I'm going to show my screen so you can take a closer look at the map. And let me share screen. All right, can everybody see my screen? Sophie, can you give me a head nod if you can see it?
Yes, you can see it.
Thank you, awesome. So this is the map, and all these little triangles that look like mountains are UIO locations. And this is where, and this is unadjusted data, so we did not correct the values for suppressed counties. So that's why there's a number of white counties. So for reference, I'm located in Hartford County right now. So we can see that there's 2,300 overdose mortalities in the beginning half of 2023. And I'm in an area between two UIOs. Oops, sorry. I zoomed in on Texas. I'm in an area between two UIOs, the New York Indian Council and Native American Lifelines, with areas affected by overdose mortalities. And so certain support may be needed for those two UIOs to better address those service areas, given the amount of overdoses. So you can see New York's county. I don't know why it's zooming in on Texas, but yes. And if anybody wants to see their county or their UIO location, you can put it in the chat or you can come off mute and I can pull that up in the search function.
So I live in Cook County, Illinois, Nahla. Do you want to show us what my county looks like?
Yeah, so for Chicago, I know where Chicago is, so I don't need to search it, but I'm sorry, it keeps going. Messing up. 1 second, let me change. Oh. So this is Cook County, Illinois. We have a UIO located there, and you can see that they have a substantial amount of overdose mortalities in 2023. And so they definitely need support in that area.
Thanks, Nahla. And we had someone in the chat ask about Arizona as well. I don't know if you can zoom in a little bit to show what the Arizona rates look like.
So Arizona, yeah, so Arizona has a substantial amount as well. So we have 4 UIOs, I believe, in the area. There's one hidden behind the other. But for Maricopa County, you can see 10,000, 2,000, things like that. So it is a state that is definitely affected by the opioid epidemic right now, or overdose epidemic at the moment. All right, so I'll stop sharing my screen, and if we can go back to the presentation. Thank you. Thank you. Okay. So now for some recommendations. Based on our analysis from the needs assessment, it is evidence that further support is needed to better address and prevent substance misuse in urban Native communities. One strategy which may help is to improve investment in integrated care infrastructures in the behavioral health workforce, particularly for Native health professionals who can bring their cultural perspectives and lived experiences into this work. A second strategy is to strengthen partnerships and collaborations between stakeholders, such as UIOs and the IHS and other agencies or health departments, so that Native perspectives are equitably incorporated into behavioral health data, policies, programs, and more. Finally, a third strategy we recommend is to increase sustainable funding opportunities for substance misuse services, treatments, and prevention resources. These funding mechanisms should have a long-term sustainability for healthcare organizations to maintain over time instead of through extremely limited grant cycles, and should be accessible to healthcare organizations without those deterrents of heavy administrative burdens. Further research by or in collaboration with Native communities is necessary to better understand the state of substance misuse and to address gaps in available behavioral health data in Native populations. Next slide, please. Okay, so we're gonna pause here to see if anyone has any questions about our needs assessment. If you have a question, please share it in the chat or feel free to unmute yourself and ask aloud. We will also have another opportunity for you to ask questions later in today's event if you're still processing something.
And Nahla, I see a raised hand from Sandra. So Sandra, you can go ahead and unmute yourself and ask your question.
So I had a question. I noticed on the map, like for the southeastern Utah, I'm in Grand County, but we also serve San Juan as well. And I just recently had a conversation with our state-funded rehabilitation program. And they have a lot of problems finding resources for Native American individuals within our community, which there happens to be quite a bit within San Juan and Grand County. Most of the time we have to refer people out to Salt Lake. And due to the area, we don't have as many Native owned organizations. We don't have a urban Indian health clinic nearby. The one that's closest to us is an hour and a half away. And for a lot of people who live here in the community, traveling that far is a barrier. And not having access to healing services that are for Native American individuals doesn't set them up for success. And a lot of people here have a lot of interest with getting access to those services. Is there ways that I could help connect this community-based one, what's called USARA, to some resources that you might have available for individuals wanting to go through recovery with traditional healing that they could do online, like a curriculum, anything you might know of?
That's a great question. I think I'm going to put my email in the chat and it'll be shared later as well throughout today's presentation. But if you want to reach out to our team directly, we can follow up with you and hopefully try to connect you all to some relevant resources.
Thank you.
And Nahla, there was another question in the chat. Does the map reflect inmate overdoses?
Yeah, so I can't say specifically if it is inclusive, but it should be, because it is all overdoses have to be reported to the CDC for the National Vital Statistics System. So it should be inclusive of that as well, but I will double check that as well.
Thanks, Nahla. And I know a few people were asking to get a link to the maps. So this isn't necessarily a tool that we've created for public use, but that Nahla had wonderfully created for our needs assessment analysis. So images of the maps will be available in the presentation and in our final report based on this assessment, which will be shared at a future date. But if there is a way that we're able to create this as a tool for public use, we'll definitely keep you all updated. Does anyone else have any other questions at this time? Feel free to share aloud or in the chat.
All right, well, if there's no more questions, I'm going to hand the floor back to Sophie to lead us into our next section of our presentation.
Thank you, Nahla. And if anyone thinks of any more questions, you can continue to share in the chat. We'll have an open floor as well later in today's presentation, so we'll address any questions that come up in the meantime. We can go to our next section. So now we're going to move into our discussion for today's event. So we strongly encourage you to participate during this discussion, regardless of your role or your background, as we welcome each of your insights and all your valuable perspectives. Next slide. So I know there's a lot of information on here, but for today's open discussion, we'll be using the platform Poll Everywhere. So all responses are anonymous for this poll. If for some reason Poll Everywhere prompts you to provide a screen name, you don't have to enter your name as it will not be displayed with the responses. So we have a few ways for you to participate. You can respond to each question by texting in your response or by joining online through any internet browser. If you want to participate via text, you can text WiredSun334 to 22333. And if you want to participate online, you can visit pollev.com/wiredsun334. And you can also scan the QR code shown here to participate online. And if all else fails and Poll Everywhere is giving you any technical difficulties, you can also feel free to respond by just staying in Zoom. So you can unmute yourself and share your responses out loud, or you can share in the Zoom chat. And if you don't feel comfortable sharing in the chat yourself, you can also send a message directly to our chat monitor, Micah, and she can share your response on your behalf. And all these instructions have also been placed in the Zoom chat for your reference. And we'll be spending a few minutes on each question, so you can take your time thinking about your response. Please note that we will still be recording this session of the event. And we'll now pause for just a moment to allow you all to get ready to participate. And if anyone has any questions about any of these instructions, feel free to ask. What is the poll presenter's name? You shouldn't need to enter any name. I think you can enter either our names or yours, but hopefully no screen names get displayed regardless. So everything will remain anonymous. All right, so we can move to our next slide and get started with our poll. So as a little icebreaker to get us started, we ask that you share what state you're joining us from today in one word. So this poll will appear as a word cloud. So if you are joining from a state that's more than one word, we ask that you use your state's abbreviation or some other way for us to identify it. And as mentioned earlier, you can text in your response or join from an internet browser. And you can join the poll at any time, even if you miss a question. So no worries if it takes a moment for you to join. And we can see here, we seem to have the most attendees today from California. Then we have some from New Mexico, Montana. I see Nebraska, Michigan, Washington, Utah, New York, I think South Dakota. So nice to see we have people coming from all over the country today. We appreciate everyone joining. We got Georgia, Kansas. Awesome. Looks like we have a lot of people from California in particular. All right. Well, thank you everyone for sharing where you're joining us from today. So we can move into our next slide. And I'll pass it over to Deidre.
Thanks. So our next question, we're just trying to get an understanding of where you are all coming from as far as urban Indian organizations. Do you work for one of the 41 urban Indian organizations or UIOs served by NCUIH? Please select yes or no. If you'd like to learn more about the 41 UIOs, you can visit our UIO directory at ncuih.org/UIO-directory. This link will also be shared in the chat. If you're having any trouble, you can just use the pollev.com/wiredsun334 or send to wiredsun334222333 to get the link. If you're having trouble with your poll screen, sometimes if you refresh the page, it'll populate the question and it will update to the more current one.
Carmen, could you try going back a slide and then coming back to this?
Okay, looks like we're back on track. We're just trying to find out, do you work for one of the 41 urban Indian organizations served by NCUIH? If you do not, then click no. If you do, click yes. And NCUIH also has a UIO directory on our NCUIH website if you are interested in learning more about UIOs. That address is ncuih.org/UIO-directory. And so we just dropped it in the chat. All right, looks like our poll is settling down here. A little less than half of you are UIOs, a little more than half are non-UIOs. I'm so happy that you guys could all join us today, and I hope you guys are learning a little bit more about opioid use and abuse, as well as UIOs, which can be found on our NCUIH directory. All right, I think we settled down a little bit. Do you want to go to the next question, Sophie?
Yep, let's do it. So our next question is, did any of the findings shared in today's presentation resonate with you or surprise you? And if so, please describe them. So as responses come in, they'll appear on the screen here. And we'll spend a few minutes on each question, like we've said, to allow time for you all to respond. And as a reminder, you can respond online or via text, or by unmuting yourself and sharing aloud, or by sharing in the Zoom chat. And feel free to respond more than once as well. So far I see no, one person was not surprised by today's findings. Seeing a lot of no's. And if anyone wants to clarify anything further about, why anything didn't surprise you, or if anything specific did resonate with you, feel free to add more. So some yeses and nos. The numbers were a little shocking with regards to demographics. Definitely. No, because there is a lack of support for NA individuals within my area. That's unfortunate to hear. One person said, I don't work directly in substance misuse, so I found the data really eye-opening regarding the need in our communities. That's great. Another person has said, as a cultural specialist, I resonate with the traditional healing services. Another respondent has shared, nothing was surprising, but the most common services resonated a bit. There is so much need to think outside the box, yet it's not done. Absolutely. Another person said, yes, the data surrounding the spike in overdoses during the pandemic. Another person shared that they thought there would be more UIOs nationwide. That's true. There's only 41 UIOs in the United States, and there's definitely a need for more specific healthcare services and traditional healing services to reach people across the country. And the spike in overdoses during the pandemic was definitely something that surprised me as well. We've heard a lot about how the pandemic affected so many different areas of public health, but to see how those overdoses spiked across, I believe, every racial or ethnic group was very unfortunate. Another person has said, no, the problem with drugs is overwhelming people in all communities. It is challenging to provide services with inadequate funding and a lack of trained staff. Absolutely. And I've seen some people share in our Zoom chat as well. Coalitions and UIOs should do more collaborations. That would be great. We love to hear about collaborations. Another person has shared, yes, there has been more collaboration and awareness of use and overdose in our area. That's good to hear that collaboration and awareness is growing. All right, I think with that, we can move to our next question. So I'll pass it back to Deidre.
Thank you. So our next question is, how has substance misuse affected your community or the communities you serve? So this is another open-ended question. All the answers are anonymous. No names will be tracked. This information is just for our discussion today. How has substance misuse affected your community or the communities you serve? And those of you that feel you were affected, if you could just expand a little bit more. So if you decide this is a yes answer, just tell us a little bit more about it. All right, looks like we have some coming in. Addiction creates instability among broken individuals, lead to broken families, which lead to broken communities. Increased number of people end up being homeless. Yes, I think I've seen that correlation as well. Loss of job, children, increased stigma about Native Americans in our community, and substance use. Yes, I've seen that correlation. Include individuals losing their jobs, losing their housing, which, as we know, negatively impacts their overall health. I agree with that wholly. Homelessness, grandparents raising grandkids, kids ending up in the foster care. Very low self-esteem, need to have more community awareness. Thank you all for sharing. How has substance misuse affected your community or the communities you serve? Let me see. Let's see, in the Zoom chat, our community has established a behavioral health coalition and the county has started a needle exchange program. Yes, needle exchange programs are really important. Substance misuse creates a cultural division for the Native population I serve. The disconnection can create additional problems in our lives. Horrifically, as the numbers rise, it affects the whole family, not just the user family, and how to heal from the experience of this traumatic epidemic. I really appreciate you all sharing this information with us today. A need for more shelters. It has greatly affected our community, and there is a lack of current interoperability and sharing of data to help prevention efforts for those suffering with substance use disorder. Increased number in dropout rates, DV, and homelessness. Meth has had a devastating impact because the staff has limited experience providing services. The cartels are powerful, more funding is needed. Homelessness, more crime, unsafe communities, a drain on funding that could be used for more proactive things. Okay, so just last call, how has substance misuse affected your community or the communities you serve? And once again, your question or your answers, apologies, are anonymous. No names will be tracked for this information. And we definitely appreciate you all sharing this with us today. I feel that substance misuse is the wrong term and adds to stigma around drug use. I also see that the lack of economic opportunities in housing leads to substance use. Thank you. I really appreciate that feedback. We will definitely note that for future events. Okay. Do we want to move to the next question, Sophie?
Yes. All right. So this kind of ties into our next question. So through your professional role, have you experienced any challenges in addressing substance misuse issues among your patients or clients? And if so, please describe them. And we know we have people coming today from many different kinds of professional roles. So if you can't think of anything that comes up in your specific job, you can also share things that have come up for your organization or your colleagues if you can think of anything. So one person has said, yes, patients don't have the funds to cover medications such as Suboxone. There's transportation barriers to get to appointments, having to prioritize basic needs versus medical care. Another person has said a lack of access to inpatient rehab. They work with individuals experiencing homelessness, and many of them express their desire to become sober, but there are barriers in accessing those services. Another person has said it's heartbreaking when someone is struggling, but there aren't services to refer them to. I'm thinking specifically about a lack of rehab/detox facilities, particularly those that are affordable and accessible. Absolutely. Not willing to be open-minded, lack of available medication for opioid use disorder, or too many barriers to accessing that medication. There's stigmas around accessing harm reduction services. Another person has said that finding folks with lived experiences who can aid in harm reduction, as some are criminalized and marginalized and kept away from roles they could be influential in. Absolutely. Other responses, accessing treatment programs in a timely manner. So clients will come in ready to stop using, and then we can't get them into any treatment for days, so they end up using and perhaps changing their mind about participating in treatment. Another person has agreed with the lack of detox or medical withdrawal facilities. We're seeing a lack of resources. The process is long to get them into detox or rehab, and coverage usually won't cover extended stays that are very needed. Another person has said funding is siloed and doesn't recognize the intersectionality of these issues, like substance use funding that can't be used for housing and homelessness initiatives, but homelessness and substance use often go hand in hand. Absolutely. Leaving and having to come back because they relapsed. Another person here has says programs seem to miss the mark sometimes. There's stigma and discomfort in addressing things head on. Communities are sometimes dead set against programs like needle exchanges, naloxone vending machines, and so on. Most places want Medicaid or insurance, but if they're homeless, they do not have paperwork for personal identification. It's a very specific barrier. An emphasis on sobriety as the only non-stigmatized option, housing dependent on sobriety, barriers to accessing resources from a lack of government funding, more funding used to help homeless people purchase birth certificates and SSI cards. Absolutely. And I believe someone shared in the chat as well, substance misuse is often precipitated by mental health conditions, and we are short of SUD providers and MH providers. Patients not willing to make any changes. Definitely, these are all big challenges. All right, with that, I'm going to pass it back to Deidre for our next question. Thank you all for sharing your responses. By the way, it'll all be collected for our analysis. So even if we don't read it out loud, we appreciate any input that you're providing. So I'll go ahead and pass it to Deidre.
Thank you. Please describe your organization's experience with funding for substance misuse services. Examples, are there any funding mechanisms that have successfully supported you, your organization? Are there any gaps in funding opportunities that need to be addressed? Okay, as we're waiting for them to roll in, I'll just reread it. Please describe your organization's experience with funding for substance misuse services. Examples, are there any funding mechanisms that have successfully supported you? Are there any gaps in funding opportunities that need to be addressed? All right, one answer coming in. Federal funding is far too prescriptive and limiting. Many orgs and tribes don't have enough or any grant writers and also struggle to have the capacity to complete the required grant reporting. There need to be more funding opportunities that are much more low barrier, both for the application process and the requirements. Opioid funding is available to every state. Being at the table when decisions are made is the challenge. We are all funded by federal health grants and tribal opioid response grants. Often funding does not allow for all the related social impacts. Please describe your organization's experience with funding for substance misuse services. This could be everything from challenges, which you have all shared, funding mechanisms that have supported you, or any identified gaps. I'm thankful that we are receiving funds to support MAT program. This helps support some staff trainings, but no funding for medications to manage opioid use. That is our need currently. Let me check the chat.
I think for the sake of time, Deidre, we can move to the next question. Thanks again, everyone, for sharing.
For sure.
All right, so our next question is, are there any programs or strategies at your organization that are working well to address substance misuse? And if so, please describe them. And again, feel free to share out loud or in the chat. I know we're almost out of time for today's event, so we won't spend too long on these last couple questions. So one person has said, our local organization promotes fitness, has brought down barriers for gym access, and has cultivated a recovery community based around physical fitness. It seems to work very well. That's wonderful. Another person said their organization is not a direct services provider, but they've seen positive impacts from culture-based programs and other organizations that do provide services. Another person has said that providing educational materials and local resources to access care has been working well. That's great to hear. And it's great to hear from the last response as well that traditional healing services are showing those beneficial impacts. Another person has said using community health workers has worked well, transitional housing. We hear from Hunter Health that something that's helping with MAT services is having same-day services. So you can get patients into care much faster if you have daily appointments available with the goal of transitioning to their PCPs. That's great to hear. Wellbriety is a newest program addressing substance misuse. We definitely heard a lot about the Wellbriety programming being used at UIOs in our interviews. Let's see. A lot of ex-drug user, ex-convicts that sign up to be wildland firefighters, and that work has helped keep them sober and healthier. That is very interesting. All right, thank you everyone for sharing. So we're gonna go ahead to our next question and I'll pass it back to Deidre.
Sure. And like Sophie said, as we're going through these questions, we are almost out of time. So if you just fill in the little section for this answer, are there any specific resources, tools that would help to support your organization in better addressing substance misuse? If so, please describe them. And if the poll everywhere is a little slow, you can definitely throw your responses into the chat, or you can verbally share those with us. Low barrier funding opportunities that support cultural-based programs. Thank you for that response. Having a website that listed in treatment sites and a mostly up to date availability at each. Yes, those are really good resources to have.
I'm sorry, I lost my ability to respond in writing, but I wanted to say that what it would be most helpful for me is to talk with other programs and maybe visit with them to see what they're doing and how it's working. That's always very helpful for me. Thank you.
Yes, best practices are always helpful. Hopefully, when we start distributing this report, we can start going along that path of connecting UIOs with successful program outcomes, and programs that aren't able to be as successful are able to share best practices. That is a big goal of ours, to connect UIOs together. Definitely, I would say shoot an email to Sophie and we will keep you all in the loop, and hopefully we can help you all connect with best practices. I know we're getting a lot of responses for this question. I know we're limited for time. Sophie, do you want to ask the next question so we can open up?
Yeah. Going to move into our last question, but thanks again everyone for sharing so many responses. We appreciate it. So our last question, oh, you can go back one slide. We're just going to spend a minute here. But what do you believe is the highest priority for improving the state of substance misuse in your community or the communities you serve? So we'll just spend about a minute here if you can think of one thing that seems to be the most pressing. I see people have said harm reduction services, resources, awareness. Those are absolutely high priorities. Harm reduction services again. Low barrier housing, absolutely. Addressing the social impacts that result in substance use, absolutely. And harm reduction services again. All right, well, thank you everyone for sharing. I know we didn't get to spend too much time on these last couple of questions, but we appreciate everyone's input and we'll definitely be reviewing all the responses, even if we didn't get to read them all out loud. So now we can move to our next slide. And we'll just pause here to see if anyone has any final questions. And after this, we do have a few closing slides as well, where we'll share some final resources and reminders. So if you could stick around for that, we'd love to share that with you. But feel free to unmute yourself or share questions in the chat. I see Sandra, you have your hand up, so go ahead.
Yeah, so I was wondering about what it takes to get a UIO center set up in our area. I noticed from the map that if you really look at it, there is a huge chunk of land between Salt Lake and I'm gonna guess that's Flagstaff, where in Arizona and Utah, where there are no UIO services or facilities. I'm just wondering because the area that I live in southeastern Utah, there's a lot of Native Americans and there's a lot within that Four Corners region. Why isn't there one set up in that area? Yet in California, there's about 1, 2, 3, 4, 5, 6, 7, 8, 9 of them. When there's a large amount of Native Americans within the Four Corners region.
Yeah, that's a great question. I don't think there's one specific answer. I think a lot of it ties to different state differences by funding and resources and things like that. If you'd like to reach out to me via email as well, I might be able to connect you to people who have some more expertise and guidance. I'm not as familiar with actually starting a UIO, so that's definitely something that if you're interested in learning more about, we can definitely try to connect you to the right information. But yeah,
Most
the map
definitely.
definitely highlights the need for more UIOs and more culturally based services as well across the country.
It's a lot of things that I've heard after speaking to other organizations. It's just the lack of, I guess, just that lack of resource for Native Americans to feel heard within their community, to feel recognized and just to be seen as an individual, I guess. And it just kind of get overshadowed by everything else.
Yeah, absolutely. Thank you for sharing that.
Yeah,
Well,
thank
I
you for
know
listening.
yeah, no problem. I know we're just about at time, so we'll share my email and my team's emails as well again in the chat. If anyone thinks of any other further questions, we're happy to connect with you and answer as much as we can. But I'm going to go ahead and move into our closing slides just to wrap up for the sake of time. So now we'll move into our final slides. You can go to the next slide. So here's some examples of CDC resources related to overdose prevention. So there's some trainings available for healthcare professionals, like modules with continuing education or interactive patient cases. The CDC also has an overdose resource exchange that can be filtered by audience and includes communication resources that are tailored to AIAN communities. And all of this will be included in the slides that are shared with you all following today's event. Next slide. And here's also some linked examples of opioid-related resources that are specific to AIAN communities. I want to highlight that the Northwest Portland Area Indian Health Board has a lot of resources related to opioid use disorder. There's educational videos and infographics like those shown here, and a lot of other resources listed. Next slide. And here you can see some of the additional events that are coming up at NCUI. So if you want to learn more, you can visit ncui.org/events. And this link will also be shared in the Zoom chat and via email following today's event with all of you. So we hope to see you at future events. Next slide. So thank you all again so much for joining us today. We really appreciate everyone's participation and your insights. Please remember to share your feedback by scanning the QR code shown here or using the link in the chat. And this link, as well as a copy of today's slides, will be shared with all of you via email following today's event, as well as a recording of the session if you'd like to view it or share it with any of your colleagues. If you have any questions, again, feel free to contact me. My email will be put in the chat and it's seen here on this slide as well. But please feel free to reach out with any questions or thoughts. And we hope you all have a wonderful rest of your day. So thank you all so much.